Okay, good afternoon, everybody. We are going to continue the topic on the health seminar. Today, the topic is side effect of Western drug, part 2. I think we have done part 1 last month. Before I start, let me do a disclaimer. All the information contained in the slide are intended for general health information and educational purposes only, and are not intended to be used as a substitute for professional medical advice, treatment, or care. Okay, objective and content of this slide. The objectives are understanding the use of the drug and its potential side effect. I think we cannot move away from drug. I think we need to address the symptom of our certain health condition. For example, if it's a headache, we might need to take Panadol. I think it's very common. However, we have our product Lingzhi is a safer option and counteract to the side effect of the drug. Okay, so today we're going to do part 2. We're going to cover antihypertensive drug, or in short we call hypertension medicine, antibiotic, and steroids. Okay, we already covered the following 4 drugs: NSAID, lipid regulators, anti-diabetic, and antidepressants last month. Today we're going to cover the 3 drugs as mentioned just now: antihypertension, antibiotic, and steroid. So let's start with antihypertensive, in short, AHT drugs. Antihypertensive drug can be seen as below: Capoten, Diovan, Tenormin, Novarsc, and Diuril. Actually, the use is to treat high blood pressure, as simple as that. It might sound a bit complicated on all the drug name, but don't worry. After today, my presentation, you are able to understand the hypertension drug easily, because we break down the type into A, B, C, D. You just remember, hypertensive medicine got 4 types: A, B, C, D. So what is A, B, C, D? Okay, before we start, let me talk about blood pressure. What's blood pressure? Blood pressure is a pressure that extended by the blood from the heart against the main artery. Okay, we know that the heart will pump the blood circulate through the body. We take in the blood contain oxygen from the lung, then we circulate to the part of to every part of the body. And after the cell metabolic, the blood with the rich in the carbon dioxide will come back to the lung and back to the heart again. So when this blood circulate, there will be certain pressure that extended towards the artery. So that is we're talking about blood pressure. Actually, there are 4 factors actually affect the heart pressure. Number 1 is the heart. Number 2 is emotional stress. Number 3 is blood viscosity. And number 4 is elasticity of the blood vessel. Okay, so let's start with the heart. The heart is usually like a pump, like a compression pump that actually pump the water from one place to another. In our body, heart actually is a pump that actually pump our heart circulate in the body, as mentioned just now. So this affect, it will have blood pressure. How strong our heart going to pump will affect the blood pressure. Second thing they're going to affect the blood pressure is there's some stimulant, mainly from the kidney. So there's a renin produced from the kidney, and also there's an adrenaline hormone produced by adrenaline gland that actually affect the contraction of the blood artery, and that actually control the blood pressure. Number 3 is actually due to the fat in the bloodstream, or we call hyperlipidemia. It's excess cholesterol and the triglyceride in the blood. So this will increase the blood viscosity. When the blood viscosity increase, then the pressure against the heart will need higher pressure to pump all these increased blood viscosity to pass through the body. Thus, the blood pressure is increased. Number 4 is we call atherosclerosis, where actually there's an excess lipid and pellet actually adhere to the surface of the wall. Actually, our blood vessel, the wall is very clean, especially when we are young or when we're still a baby. But when you age, we eat a lot of food that contain fat, cholesterol. So all these fat and cholesterol will start to stick to the wall of this blood vessel. or sometimes as easy that what you think is, if I'm not sure, do you ever open out the pipe, the water pipe in your house? If you have a chance to do that, you see that all the dirt actually adhere to the pipe wall. So same thing for our bloodstream. Actually, we have all these lipid and pellet adhere to the wall, and that will actually decrease the diameter of the blood vessel, and thus the volume of the blood that can pass through this blood vessel actually reduce. And actually, when this thing always stick to the blood wall, then it will become fiberization. So heart will need to increase its force to contraction. So there's also have this high blood pressure. So the heart actually pump the blood vessel pipeline, demonstrates sign of wear and aging after age of 45 years old. So the maintenance of blood fluidity and vascular elasticity is important to control hypertension. So if you cannot do that, we cannot control our blood fluidity and the vascular elasticity, then we might need some drug to do the job, and this drug is actually the one to control the symptom. But before that, there are how do we test the blood pressure? Actually, blood pressure, there are two. One is called systolic, it's the top number. The other one is diastolic, it's the bottom number. You can buy a blood pressure machine to measure, and normally you will actually just surround the so-called the vest in your arm. Then they will pump air, and after that they will start measure your systolic and diastolic blood pressure. So and what is a normal range if you want to diagnose, if you want to be a healthy, if you want to diagnose as a healthy blood pressure? So your systolic must be below 120 and your diastolic must be below 80. If your systolic 120 to 139 and your diastolic 80 to 89, then you are the pre-hypertension range. Stage 1 of hypertension is systolic 140 to 159, diastolic 90 to 99. Stage 2, where normally we need intervention, we'll be having a systolic of more than 160 and diastolic of more than 100. However, if your age above 60, then your systolic can be at 150 and your diastolic at 90 is still considered acceptable range. Okay, so we move on to see what kind of drug that we have for anti-hypertensive, or we call the hypertension medicine. As I mentioned earlier, there are 4 types classified as A, B, C, D. We start A first. What's A? A, just remember, is ACE inhibitors. What's ACE inhibitors? It actually block the action of this angiotensin converting enzyme. In short, we call ACE. We must inhibit this. So actually, we able to inhibit, it can slow the heartbeat and reduce the force of heart pumping. So the type of this kind of medicine is very easy. It all end up with RIL, Captopril, Amlodipine, and etc. All the medicine end with RIL is belong to ACE inhibitor. Okay. So what is this ACE inhibitor? Okay, it may be a bit complicated, but let me explain. Your kidney is actually will prevent, in the normal circumstances, your kidney will release renin. Okay, and when your pressure is not enough, so the kidney will will produce renin, then combined with the angiotensin released from the liver into angiotensin 1, and after that you take another enzyme from lung, so you become angiotensin 2, and this angiotensin 2 will cause the constriction of the blood vessel, make the blood vessel smaller. After this, then the heart pressure will go up, so the blood pressure will be pumped faster, because you actually remember you just constrict the water pipe. If you just imagine the same volume of the water in the water pipe, we make the pipe smaller, obviously the blood pressure will be increased. Same thing for the bloodstream. So in this case, it's a normal circumstances where the body want to increase the blood pressure, for the kidney to produce renin, liver to produce angiotensin, then the lung to produce another ingredient that will form angiotensin 2, then will cause constriction of the blood vessel, then the blood pressure will increase. So if you want to reverse this so-called process, for example, a person already have high blood pressure. You want to reduce it. So this medicine actually do a very simple job. He actually just stop the conversion of AG1 to AG2. So you stop here. Once you stop here, or once your angiotensin 2 not able to produce or inhibited, then the blood vessel will become relaxed already. When you become relaxed, so your blood pressure will reduce. So this class of medicine actually getting inhibit the angiotensin 2. When you inhibit, so the blood pressure will be relaxed, so your blood pressure will be reduced. Okay. So however, there's downside effect of this medicine: hypertension, headache, dizziness, fatigue, nauseous, and persistent dry cough. Because this persistent dry cough side effect due to accumulating of the kinins in the lung. So imagine this medicine also affect the body, and remember, actually renin is produced by the kidney. So remember, all the medicine actually will affect the kidney. So this drug actually inhibit angiotensin 2, which actually the earlier part was produced by the kidney. Okay. Okay, we move on to the B. B is beta blocker. People might heard about it. Beta blocker actually block the effect of adrenaline. Adrenaline is actually there's an adrenaline gland on the kidney, adrenal glands on the kidney, and this adrenal gland actually will able to produce adrenaline. And what is this? The adrenaline hormone is actually able to increase your heart rate. So this adrenaline actually is controlled by emotions. Sometimes when you become angry, in the English wording, there's a wording, there's a sentence that says, you'll make my adrenaline pump faster. It means that you will make your blood pump faster. So when sometimes we are scared, you can hear when some of you are very scared at night for some reason, you can hear your heart pump faster. Okay, so actually it's the effect of this, because this adrenaline able to produce more this adrenaline line and able to pump the blood faster. And sometimes and why do you need to pump the blood faster? Because your body asks for it. You need more blood circulation to have your more oxygen in your brain for you to focus, whether you are being scared or sometimes we need attention on doing something. So your blood pressure will increase in this way. It's actually a normal processes. But however, maybe sometimes you always work late night or you always need a lot of all this kind of energy. So end of the day, your adrenaline line will always be high. So that if there's a mechanism or there's a medicine you can block this, then your blood pressure will not be high. Am I right? So this beta blocker actually block the beta receptor for the body to absorb this hormone. So in return, you are able to relax the blood vessel, decrease blood volume, and decrease oxygen demand from the heart. So in this case, it also reduce the blood pressure. So it also linked to the kidney. Am I right? The first medicine, AC, actually also related to the working of the kidney. Second one also related to kidney. So your kidney is very important for blood pressure regulating. So side effects of this drug include cold hand or feet, extreme tiredness, weight gain, dizziness, or light headache. Okay, so we come on to C. C is calcium channel blocker. Okay, our heart, that actually there's a like a printed circuit board, PCB printed circuit board. Why there is printed circuit board in the heart? Because heart is pretty autonomy. You can heard about sometimes there is actually a brain death, the brain not functioning, but the person still can survive through, because heart is the organ that's actually not controlled by the brain. So it itself have this so-called the electric circuit where the electrical will flow to control the pumping of the heart. So calcium channel blocker actually obviously is actually blocking the calcium, because for this thing to functioning, you need a calcium to pass through all this electrical signal. So calcium channel blocker actually block the entry of calcium, reduce electrical conduction within the heart. So you decrease the force of the contraction of the muscle. Thus, you dilate the artery. Remember, the more we can dilate artery, the blood volume actually in the blood vessel actually reduce. Just remember, your water pipe suddenly become very big. Your pressure in the pipe will reduce. Am I right? So this medicine is actually very easy to identify. All end with INE. Pine, or end with INE or PINE. You can see. So all these medicine end with pine. Amlodipine is a very common one. You'll be a calcium channel blocker. The side effects include constipation, dizziness, fast heartbeat, and sometimes you have extreme tiredness, and sometimes swelling in the feet or lower leg also can be a side effect of calcium channel blocker. Okay, after we cover A, B, C. Now we go to the D, which is called a diuretic. Diuretic, by the name imply, actually is actually get water out from the body. So how diuretic work? Okay, in your kidney there's this smaller cell called nephron. Nephron is the one that actually filter all the waste from your blood and become urine. So this one is actually have a mechanism where you can absorb back all the water. So sometimes, for some reason, your body got a lot of water retention. The doctor might give you diuretic medicine. It means that there will actually less absorption of the water throughout all this nephron. Then you have more water coming out. So actually, this medicine who is controlling the hypertension medicine, actually it will eliminate sodium and water by kidney. Because sodium actually it will cause more water going to a bloodstream. Then your blood pressure will increase. So if you're able to reduce sodium, then in your bloodstream, then your volume will decrease. Just like hypertension people or people who have kidney disease, doctor always advise take food that have less sodium. So this diuretic medicine is actually have three types: thiazide, loop, and potassium sparing. These are three types. Okay, so this medicine work by actually inhibiting the power that can absorb the so-called sodium and potassium. So, however, the side effect, you have more urination, low sodium, and low potassium. Okay, so this also related to the kidney. So, in fact, all the hypertensive medicine is 4 types: A, B, C, D. Okay, and all of them actually will do with your kidney. So, kidney actually on blood pressure regulating are very important. Okay, so, and another thing is hypertension medicine got 4 types. So you cannot share your hypertension medicine with another person who has hypertension. Not like cholesterol medicine only got 1 type, statin. So you still can share around, but sorry, I'm not saying you can share around. But for hypertension medicine, for sure you can share around, but there are 4 types. You need to depend on your condition, and they'll prescribe the type of hypertension medicine for the patient. And some of them might prescribe 1, some of them might prescribe 2. So don't ever share your hypertension medicine with another person. Okay, we move on to another class of the drug called antibiotics. I think we heard about this antibiotic. Antibiotic is actually first found by Alexander Fleming in 1998. I think you all heard about penicillin, right? This is the very first type of antibiotic. Antibiotic, a lot of people will know that actually to treat infection disease caused by bacteria. And you have to bear in mind that antibiotic will not work for virus or fungal infection. Sometimes virus cause common cold, flu, or cause bronchitis, all this etc. So sometimes you have flu, you go to the doctor will not give antibiotic because there is virus attack. So only you cannot settle within a week. Maybe your body immune is low already, you cannot attack by antibiotic bacteria. Second time you will see a doctor, then they prescribe the antibiotic. Overuse of antibiotic also cause so-called we call the drug resistant. It means that antibiotic will not work anymore. So I will touch on that later. Some of the famous trade names for antibiotic including Augmentin or Amoxicillin is the same type of antibiotic. Okay, so antibiotic in actual fact got about 1, 2, 3, 4, 5, 6, 7 classification. There are 7 type of classification of antibiotic. Okay, but most common one what we are taking most of the time is amoxicillin, which is under the penicillin group. Okay, and they all work differently. So how it work? Okay, when your cell kena bacterial infections, okay, so the antibiotic work in many area. For example, it can kill bacteria by destroying the bacterial cell wall, or sometimes antibiotic work by uh, interfere with the ability of bacterial cell to reproduce or make protein or nutrient they need to survive. So different type of antibiotic work differently in the body to kill the bacterial cell or to prevent the reproduction or to inhibit the making of the protein for them to survive through. So different type of antibiotic work differently. So same thing, antibiotic cannot be eaten without prescription because you don't know what kind of bacteria are there in your body. So you still need a doctor attention. Okay, the side effect of the antibiotic including soft stool, diarrhea, mild stomach upset, vomiting, and even allergy. Okay, why say so? Because antibiotic, it will kill the bacteria. Am I right? That's the purpose. It will kill good and bad bacteria at the same time. So our body need good bacteria, am I right? For your intestinal tract, okay. Sometimes for your even for the vaginal tract, even for the tongue area and all this. So when the moment you kill the good bacteria, the bad bacteria also kill the good bacteria. So if there's an imbalance of good and bad bacteria in your body, so that's why you will actually have this diarrhea. For example, you are not able to digest well, and sometimes there's this vaginal itching because this antibiotic kill a range of bacteria, also kill healthy bacteria in your vagina, leading to overgrowth of yeast. And sometimes people will have labeled white patches in the tongue. You know why? That is because you kill all the good bacteria, so there's no good bacteria protection you from this yeast infection. So that is actually a side effect antibiotic. But however, there's a very easy remedy for this. You only need to top out or consume probiotic. And then you will have a balance of good or bad bacteria, good or bad bacteria in the body. So whenever a person take antibiotic, it better couple with our probiotic like lactoberry. In fact, a pediatric doctor normally when they prescribe antibiotic to children, they will prescribe one course of probiotic as well. I mentioned just now, as overuse of antibiotic actually cause a resistance. So that's why doctor now in Singapore has very reluctant to give you antibiotic if they don't think you need to do so. So you can see consequences of bacterial resistance actually causes a lot of death. Like for example, in US, 23,000 yearly. Okay. So what is this antibiotic resistance? Because antibiotics are only able to kill certain strain of bacteria, but they kill other bacteria. So bacteria with certain tract survive through. For example, you only kill this, but the other tract bacteria survive through, and now they are able to multiply and colonize. So you might need another type of bacteria to work on it. But even the day will come, you will use all type of antibiotic that work on the bacteria in the body. So it's a very alarming situation in the whole world, because the day will come, none of the antibiotic will work for those bacteria that attack our body. So we don't overuse the so-called antibiotic. Actually, there's a way we can do it. Okay, I'll share with you later. Don't even need to depend on antibiotic for certain situation. Okay. However, let me come up with the last type of drug we're talking about, steroid. Steroid is a naturally occurring hormones. Actually, it's produced by body or made synthetically in the lab. There are two types of steroid. One is called anabolic steroid, and normally people use it to enhance athletic performance and building muscle. There's a cortisol steroid. Actually, this is the one to reduce inflammation and treat autoimmune related disease, and this is the one we make into drug. So this cortical steroid actually is different from anabolic steroid that used by athletes. Actually, there's a small amount actually produced in the body, the adrenal glands in the kidney or on top of kidney. So this steroid actually used to treat arthritis, asthmatic, autoimmune diseases, skin condition, or some kind of cancer. So the very famous treat name is called prednisolone. I think a lot of people, many of us have heard about it. And how this steroid works is actually steroid has its anti-inflammatory effect because they reduce the body production of prostaglandin. Prostaglandin is actually one chemical produced by a body to protect us. But this thing actually, when there's an injury in our body, this prostaglandin will actually produce to help to cover this injury part from attack by the bacteria or viruses. However, this prostaglandin is the one that actually look like actually causes all this inflammation in the body. Actually, the mechanism is good. They need this. They need this to protect our body. Actually, inflammation is good, but you need to protect the body. But after that, you need to get the inflammation part of the body to subside faster. Sometimes the body not able to subside all this inflammation, so it might need to depend on medicine. One of the medicine will be steroid. However, steroid actually suppress this so-called prostaglandin in a very high level. I think you all heard about NSAID. Am I right? NSAID is actually talked about this in the last month, part one of the drug. So actually NSAID actually suppress all the progesterone in a much lower level. You can see steroid suppress in a higher level. So generally, steroid have a higher side effect as compared to the NSAID. So what's the side effect? I think sometimes we can see is a cushion appearance. Means that you actually have this like 水肿 on the means that you have a moon face or your body part, your leg or there's some swollen. Okay, sometimes they affect the sleep, you affect your mood, and some people due to this they are quite they cannot tolerate to steroid. They can actually have even the psychotic effect after taking steroid. They might have very funny behavior. Okay, so they can cause neuropathy, neural pain, and hypertension is one of the side effects. Okay, osteoporosis causes diabetic. Okay, and causes cataract, and for children it causes growth retardation. Actually, immunosuppression. Your immune system become very low now. Okay, so this is a side effect of steroid. Actually, for the bottom line, if you're not necessarily don't take steroid, so that's what even the doctors say. Okay, let me introduce a product I'll talk about is the Lingzhi. Lingzhi has been 2,000 years of history and 50 years of modern scientific research. And if you type Lingzhi Ganoderma in the PubMed, a National Library Medicine Library in the internet, you can find many research topics in Lingzhi. Okay, so this Lingzhi can do what? We cover 3 types of drug today. Okay, steroid, hypertension, okay, and also the antibiotic. Actually, for example, the antibiotic and steroid, actually the aim is to prevent inflammation and reduce inflammation. However, if your immune system is good, chance of inflammation come is actually less. So when we talk about immune system, we definitely need to understand what's the immune system. So the immune system is our ultimate line of defense. There are actually 4 types of cell. We talk about frontline, and the frontline defense, and also the second line. Frontline actually have this phagocyte. This one is the first line of identification and extermination of cell. So whenever our body gets all these invader, okay, come in, the phagocyte just eat them out. So this is how the phagocyte look like. Natural killer cell is actually also a frontline kind of immune. Actually, it's actually also kill invader cell, but most of the time he actually kill cancerous cell, those mutation cell. However, if the front line is actually so-called being so-called broken down, it means that sometimes the bacteria, there's a lot, you kena bacterial or virus infection, so you will go into your body, so you need to depend your second line. Second line include T cell and B cell. T cell got two, one is hyper T, one is cytotoxic T. So T actually able to kill viruses and bacteria that coming in. However, sometimes it kill wrongly, so that causes immune overreactive. Hyper T actually giving warrant to run out viruses and bacteria, so actually giving warrants to all these cyto T, and also give to warrants to B cell that can produce the right antibody to kill the bacteria or kill the invader. So this is how our so-called our immune defense and how it works. So in order to have a complete immune strategy, you need to destroy enemy immediately at the first line. That is actually enhance production of immune cell within a short time frame, okay? And you must also prevent overreactive immune system. Don't make your immune system overreactive, okay? And you must production of antibody within short time frame. Produce all the bullet to kill all these invader. Just in case the invader is multiplied too fast, your normal immune cell is not able to handle them anymore, okay? So Ganoderma through the research actually able on regulating immune system for the following. Number one, actually is able to activate the first line defense. That's talking about the natural killer cell and phagocyte. So it can destroy enemy immediately. It can actually increase the fighting power of this phagocyte by 80% and increase 2 times fighting distance for the natural killer cell. And another one, Lingzhi actually or Ganoderma able to enhance our second defense system, which is our immune cell, enhance production of immune cell within short time frame. So in this case, they are capable of promoting the growth of the immune cell T and B. Okay, this is the second line. So at the same time, actually, it can actually through T helper cell, and they're actually capable of regulating the function of T cell. So by this case, you will not have this overreactive immune system. So we can prevent things like SLE, pneumothorax arthritis, which is all the autoimmune disease. Okay. Another thing that Lingzhi do is actually capable of promoting the production of antibody, which we call the bullet, to kill the large amount of invaders. So Lingzhi have been able to do the following 5 mechanism. So you will keep our immune system in check. So by doing so, you're not easy to get inflammation infection easily. So whenever you're not easy to get inflammation infection easily, then you don't need to take antibiotic. And at the same time, you don't need to worry about too much inflammation where the extent you need to take NSAID or even steroid. So this is the thing. So Lingzhi is a very good supplement in this case. Okay, talk about hypertensive prevention on the Lingzhi research. Okay, you can see the research from the Sendai, Japan. It can lower cholesterol, triglyceride, and lower blood pressure. And in this Nihon University Tokyo research, actually it can reduce hypertension on a group of patients by 10 to 20 mmHg. Actually, they are all moderate and severe patients. In this Morigiwa, Japan research, actually they can reduce the ACE concentration. So this is a very good, all can actually help to prevent your blood pressure to shoot up or hypertension. Okay. Conclusion, drugs are required as quick remedy to illness, although they inhibit certain degree of side effect to the body. So, but however, sometimes your symptom is too many or too serious, you still need to depend on drug. Ganoderma or Lingzhi has a long-term body function regulating effect. Okay, so he actually have also can, beside working protect your body, he also have effect of reducing the side effect of Western drug. I think that's what we are very good. Okay, so that's all for my sharing today. Okay, thank you.